This is Counterpoint, and I'm your host, Tanya Granic Allen. Canada's universal healthcare system is under enormous strain. Millions of Canadians are waiting for surgery, struggling to find a family doctor, or spending hours in overcrowded emergency rooms. Yet, new research suggests that while many Canadians wait for care, taxpayers are also footing the bill for millions of dollars in unpaid medical expenses incurred by foreign visitors who receive treatment and then leave the country without paying. There's also concern of a few patients, Canadians that is, who have excessive use of the healthcare system. And what do we mean? Well, we'll talk about that in a moment, because the numbers surely are staggering. So according to new research by secondstreet.org, British Columbia, for example, has written off more than 200 million in unpaid healthcare bills from non-residents since 2020. And while Alberta has absorbed another 92.3 million over the same period, researchers estimate that Alberta's losses alone could have paid for roughly 7,600 hip replacement surgeries at a time when thousands of Canadians remain on waiting lists for medically necessary care. And further, a new policy brief raises an uncomfortable question about how Canada's primary care system is being used. Freedom of Information data show that thousands of Canadians had more than 50 appointments with a family doctor or other primary care provider in a single year, while hundreds exceeded 100 visits. I don't even know how that's possible, truly. The most striking case was a patient in Ontario who recorded 362 GP appointments in 1 year. That's right, almost one visit every single day. Well, at a time when millions of Canadians, again, struggle to find a family doctor, the findings raise important questions about how limited primary care resources can be used more effectively. Well, I'm joined now by Colin Craig, president of secondstreet.org, to discuss his organization's latest findings and, of course, these reports. Colin, thank you so much for coming on. So when I was going through these reports, I mean, there's so many. First of all, I didn't realize we have this idea in Canada that one does never whips out your credit card or you never have to pay for any health care. But apparently there are, millions and millions, hundreds of millions of dollars in unpaid medical bills from tourists. So I want to talk about that. And also this, I call it madness. I don't even know why this is happening, but we're going to discuss that later on about why someone can have 362 medical appointments. I don't even know how that's humanly possible, but we'll talk about that. Okay, so tell me about this foreign use of our healthcare system. This is a thing? What is this all about?
Yeah, so we were talking with someone who retired from working in a healthcare bureaucracy in a province in Canada, and she said to us, you guys should take a look at the fact that we're spending millions of dollars on healthcare for people that don't even live here. So people that come to the country, they receive healthcare for like they're here for a trip, business trip, pleasure, whatever. For whatever reason, they're in the country temporarily. They receive healthcare services. They're given a bill and they don't pay the bill. So the government tries to get the money back and eventually they write it off because they've just concluded we're never going to get this money. And so that's what we've been trying to calculate right across the country. We've released some of the data we've received so far. And in the case of British Columbia, it appears to be probably the worst province in the country when it comes to this problem. Over $200 million spent on healthcare for people that don't even live here.
Yeah, that's a staggering amount. Again, I never even thought this was a thing. So kudos to you guys and this, person who tipped you off. Uh, so this seems like it's primarily a problem with tourists, like temporary visitors, uninsured foreign nationals, I guess. But who is leaving these bills unpaid? Is this really the crux of the matter? Just people who happen to be here on vacation, they have an emergency need, and then they go for treatment. And of course, we want to treat people, and then they just walk out.
Yeah, so we're still digging into it because you're raising important questions. I mean, we know these are non-residents, so they're not living here. They're not like here temporarily or whatever, right? As a foreign worker or whatever. These are people that come for whatever reason, and you can understand, Tanya. I'm not saying all of this is like nefarious. Someone goes on a trip, they have an accident. You might end up in the relying on that country's healthcare system. But you should pay for your bills. And this is where the problem is that governments have, particularly in BC, they're just not doing a good job at recouping these dollars from people that are receiving healthcare. And so we've certainly raised this. We think government should be looking more closely at it and exploring some changes so that money that Canadian taxpayers pay is actually spent on healthcare for Canadians.
Okay, we're going to pick up this and some more topics when we return from this commercial break. Please stick around. Welcome back to Counterpoint. I'm joined by Colin Craig, president of secondstreet.org, as we uncover the over 200, $300 million of unpaid bills, just in 2 provinces, by the way, unpaid medical bills for treatments to foreigners, people who are not Canadians, who travel, maybe they're on vacation, visiting, I don't know, the CN Tower or the Bay of Fundy, and then they require maybe emergency medical treatment, and then they leave the country, and Canadians are left to foot the bill. So, Colin, this is something I never, it didn't dawn on me because I actually do purchase travel insurance when I go to countries, and I've had healthcare, emergency healthcare in developing countries. I've had it in the United States, you know, where things happen. I have 5 kids. You can imagine what happens. And I
Yeah.
can tell you right now, in both the developing world and in the United States, you're not going to get treatment unless you have an insurance policy or you've thrown down your credit card. So, what do other
Yeah.
countries do differently that Canada isn't, and how do they manage to recoup the funds and yet we don't?
Yeah, that's a very good question. Good point. I mean, I think it's responsible to have travel insurance when you go abroad because accidents by their nature are unplanned, right? You're not expecting it. And, the bills for healthcare services can be quite costly. So, in terms of other countries, there's different procedures. So in Europe, and as one example, depending on where you're from, you might be required to have travel insurance before you enter Europe. So, I mean, that's one option that we've identified for the government to do is to just require people coming into Canada to have health insurance. And then that would prevent cases where Canadians are having to pay for healthcare for people that don't even live here. I mean, you mentioned, I think, the United States, right? Where if you need something done, you have to pull out your card and show that you can pay for it before they provide the service. Now, if someone's coming in with a heart attack, my understanding is that you don't have to show your credit card in the
No,
US, and I don't think that would be something we would we would do either, right? I mean, it's a very serious situation. The last
of
thing you want to worry
course.
about is, the credit card. But if you're coming in with, a really bad sore throat or maybe, something that's less serious, then certainly, the system could be saying, okay, well, we'll help you, but can you just indicate and show us that you can pay the bill?
And again, I'm not trying to be engaging like some kind of like crazy vigilante justice or something like this, but you know,
Yeah.
I assume sticking a hospital with say a $5 million bill or a $1 million bill is theft, and that's a criminal act. So, considering we have international warrants for all sorts of criminals around the world, like, wouldn't this count as like there has to be a consequence? And there are organizations
Yeah,
that will help cover healthcare bills if you can't afford. It's not like that it's someone who can't afford and they've taken off. It's almost like there's an intentionality to this.
I mean, that's an interesting point. I haven't thought of it that way. I think really what we need is for governments to pay more attention to this issue. I mentioned BC is a particularly bad province when it comes to this problem. Their numbers are double what Alberta's are. Now, BC probably gets a bit more in the way of tourism, especially when it comes to people on cruises and that stopping in Vancouver, Victoria, whatever. So they might naturally have higher numbers, but when it's double Alberta's, I mean that suggests to me that BC isn't addressing these types of situations properly. So there's some things that provincial governments could do on their own. I mean, they could simply require their health regions to, get the money before they help patients. Like I said, with an exception being an emergency case where you're coming in with like
Right.
a heart attack. Um, so that is one option. There are options that Ottawa can do too. Like I said, require people to have health insurance before they come into Canada. Or maybe it's based on the country where someone's from. If there's a particular nation where this is a problem where people are coming here from that country and they're just not paying their bills, whatever. I mean, you could discriminate. That's what they do in Europe. Another option would be, to your point about the accountability side of this, just don't let someone back into the country if they have outstanding bills. I mean, there needs to be accountability here. So if you come to Canada, you use the system, you're not paying your bill, you go back home, and then you want to come back into the country to visit your relatives, I think we could just simply say, no, no, you got to pay your bill first before you get back into the country. So those would be 3 policy options that
Hmm.
could be considered by governments when it comes to this issue.
So has any provincial government, and I'd love to, by the way, do Ontario next. Really curious about that one. Has any provincial government responded to your findings? Like, have either BC or Alberta responded to your findings, or have you seen any interest in pursuing this, or are they just writing this off as miscellany?
We haven't seen anything yet. BC kind of shrugged its shoulders and suggested that, yeah, we try and get the money back or whatever. They're not explaining why their numbers are, twice as bad as Alberta's. I think governments need to take this situation more seriously. And as for your point about Ontario, yes, we're gathering the data for Ontario. We've got the data for pretty much most of the country. We're going to be releasing it. We're talking hundreds of millions of dollars here that is being wasted.
I don't even want to think about it, Colin. Okay, we're going to be back in just a few moments. Welcome back to Counterpoint. I'm joined by Colin Craig, president of secondstreet.org, as we uncover some very interesting numbers and things I never knew about the Canadian healthcare system. For example, we just covered in the last segment that apparently there, in 2 provinces alone, there are about $300 million worth of unpaid bills from foreigners who just maybe come here on a vacation, use our healthcare system, and leave. Maybe they had an emergency. I'm not judging the circumstance, but we're paying for that bill now. Okay, well now, and again, I'm not prejudging these patients. Maybe they had genuine need, but I'm going to talk to you right now, Colin, about this. So you at secondstreet.org did a report that found that thousands of Canadians have more than 50 medical appointments a year from their primary care providers, so likely their GP, including one patient, I think you said it was from Quebec, who had 362 appointments. How is that even possible?
Well, that's a good question. I mean, internally, we kind of joked and wondered, what days did that patient take off? 362 appointments in a single year. I mean, that's a crazy number.
Well, or this person is really, really
One,
ill. Like, and of course, like my heart goes out. But so it's either like this person's really ill and we don't have efficient delivery of medicine, or someone is like maybe a hypochondriac and is abusing the system. Like something's got to give here.
yeah. So I think really, I mean, these numbers are pretty crazy. I think they boil down into probably 3 categories, Tanya. I think there's some legitimate cases for sure where people
Totally.
have very unique, rare health conditions where they need a very high number of appointments with a general practitioner. And that's what these are. These are appointments with a general practitioner. So I think there's some rare cases where they are genuinely acceptable and necessary. The second category, I think, are cases where patients are abusing the system, just outright, having appointments because it's, kind of a social thing. Maybe someone's lonely, maybe they're a
Really?
hypochondriac, like you said.
Wow.
Yeah, and we saw one case where someone was commenting online after we posted this data, and they said, "Well, I used to work in a clinic, and there were patients that would come in once a week, just to check in." Well, I mean, the healthcare system's not there for you to just check in. You go there when you need help, rather than going, every week just to see your doctor just for fun or whatever, right? So I think there's some patient abuse happening for sure. And then I think the third case would probably be cases where doctors are abusing their ability to just go and build a system. And so I think, probably in a case where you've got 362 appointments, it's probably where, maybe a general practitioner is working in a nursing home or something like that, or
Right. That's what
popping
I was
by the
thinking.
nursing home.
Yeah,
Yeah,
and
and
maybe
just
there's like a
racking it up.
complex
Ching,
patient.
ching.
Yeah, that's what I'm thinking.
Yeah,
They have to check in on the patient every day, and maybe that's considered a visit.
well, yeah, and the question is, well, do you really need to check in on that patient every single day for a year? Like I think there's probably some abuse. And actually in Ontario, what we noticed was an auditor's report from last year where the auditor, certainly shined a light on cases where doctors were abusing the system. And, I think I want to be clear. I think most doctors are probably got into healthcare for the right reasons. They want to
Right.
help patients. So they're not abusing the system. But there are literally thousands of doctors across the country. I mean, you're going to find some bad apples who are abusing the system. And what Ontario's auditor found were cases where some doctors were billing for more than 24 hours worth of work in a single 24-hour period. So which is obviously impossible unless they found a way to defy the laws of physics. You can't do 24 hours worth of work in
Well,
24 hours,
they
right?
can let me know because I'm still looking for the solution for that problem. So
Yeah,
great.
yeah, no kidding. No kidding. So
Wow.
yeah, I think all that to say, I think there's some abuse happening on the part of doctors too, and the big picture here is I think these numbers are worth governments taking a look at to review, because if they can address some problems,
Right.
then it frees up resources for patients who need access to healthcare and they can't get it right now.
Well, and I think sometimes the system is set up for doctors to have these numbers reported. And what I mean by that is, you'll frequently see at general practitioners' offices, you're not allowed to talk about more than one issue per visit. So if you need a
Mhm.
requisition for, and some of this could be like excessive blood work, right? You're trying to do investigative work to find out what's wrong with my patient. We need like CTs and echoes and EKGs and ultrasounds. I mean, and if you have to go to the doctor for each of these requisitions as required, because maybe there's a way the billing structure is set up, then
Yeah.
and for time constraints on the doctor, then that's where you get the repeated upticks. Um, so it's almost like a catch-22. The system kind of is creating this problem. It's a potential. Anyhow, we're going to explore more of this when we return from this commercial break. Please stick around. Welcome back to Counterpoint. We're discussing concerns and potential opportunities for improvement within the Canadian healthcare system. And joining me is Colin Craig, president of secondstreet.org. Okay, Colin, let's talk about some of the points I kind of dragged out to our commercial break in the
Mm.
last segment. Sometimes, like I said, maybe the system is built in such a way for like billings with the doctor or time with the doctor that it can kind of create the environment for these kinds of over excessive use of the GPs. Did you find
Yeah.
anything that might peak or lead to that kind of conclusion?
No, not in terms of data. I mean, anecdotally, one person that we spoke to that, previously worked in healthcare and government, I mean, she described to us an example with her own situation. And she said that she had, I think it was a problem with her hip. And she said basically her doctor made her come in like several days in a row. So on day one, it was for the same problem. So day one, it was, okay, I'll give you a requisition for an ultrasound for your hip. Day two, the patient comes in again about the hip, and he says, okay, today I'll just give you the requisition for an x-ray. And then day three, it was whatever, blood work. It was just quite clearly not how the system should operate. And, as a patient myself, I had an issue with my shoulder, and the doctor just gave me all the requisitions in one day. So it is possible to just be efficient and get it all done in one shot for the same issue. But I think there's abuse going on when you're just having the patient come in again and again and again for the same thing several days in a row, when you could just do it all in one appointment and bill once. But obviously that doesn't bring in the same amount of money for that doctor.
Right.
So, I think things like that could be tightened up. Ontario's auditors report has some good ideas on things to do when it comes to doctor billing, like, checking high volume cases, using data analytics tools to maybe flag some cases when they start to get quite high, things like that. So I don't think it's something that is impossible to deal with, but you just need governments to start paying attention to issues like this,
And I guess
because
as you're
we've got.
saying, as you're listing these tools, I said, "Oh, I'm sorry. Do they not do this already?" I always just assumed that one would aim for efficiency. So
Yeah, yeah. I mean, it's reasonable to think that with all the billions of dollars in the healthcare system, someone would be doing this already. But, as far as I recall from Ontario's auditors report, they were kind of scratching their heads saying, we flagged this issue years ago, like something should have been done. So I think, these changes that we're talking about, Tanya, they're not going to fix the system overnight or solve all the problems. We've
right.
got major problems in our healthcare system, but if you start making some of these changes and addressing them, then we can see our tax dollars being spent more wisely and being able to help more patients in the system. So these things need to be tackled for sure.
Now, one province that seems to be really taking the bull by the horn, so to speak, on healthcare reform is Alberta, and that's under
Mhm.
the leadership of Premier Danielle Smith. What kind
Mhm.
of strategies or policy implementations are they doing? What are they implementing to reform their healthcare system?
Yeah, they're doing three big things, which I think every other province should be doing as well. Number one is they're going to allow choice. So they're going to continue to have the public healthcare system, but they're going to change some rules to make it easier. So if people want to pay privately, they can do so in Alberta, rather than having to fly to another province to pay, which is what a lot of provinces require right now, is they don't allow people to pay in their own province. So
Mm,
that doesn't make any sense. So Alberta's changing that. Second thing Alberta's doing is to change the system so that um, it incentivizes the healthcare system to spend the dollars they receive on things that help patients, like doctors and nurses, rather than the bureaucracy. And at the same time, it's going to be done in a way where it incentivizes output. So hospitals will be incentivized to help more patients instead of just giving hospitals a big check each year and hoping for the best, which is what a lot of provinces do right now. And then the third thing Alberta is doing is on prevention, trying to give help patients who are taking an active interest in their health and trying to find diseases in that early. If they do, by paying privately for like an MRI scan and they discover
Hmm.
cancer or something like that, Alberta's going to reimburse them for the cost of paying for that scan, because it's better for the healthcare system if you can catch something like cancer sooner
Yes,
rather than it expanding. It's much more expensive, and it also obviously helps improve patient chances of survival.
absolutely. Okay, Colin. Well, that's all the time we have for today. Thanks so much for coming on. Appreciate it. Well, that's all the time we have for today. If you'd like to suggest a topic for the show, feel free to reach out via X at Granic Allen or via the News Forum website. This has been a Counterpoint. Thanks for watching.